Welcome back to CNN Saturday Morning. It is 42 minutes past the hour. From coughs to headaches and the occasional stomach ache, more and more Americans are turning to alternative treatment. It's a broad term for anything, really, from foods and spices you can pick up at your local grocery store to yoga, acupuncture, and even massage. Dr. Lawrence Rosen is one of the experts leading the way on this. His new book, Treatment Alternatives for Children, focuses on non-traditional cures for children. Dr. Rosen, thanks so much for joining us this morning. Such an interesting topic. A lot of people talking about this. So tell us what kind of things we're actually talking about here, and why try some of these over, say, pills and the real medicine?
That's a great question. I think, I came to the book through one of the parents in my practice, Jeff Cohn, who said, on a daily basis, we're talking with families about not just conventional medicines, but also all the things we found over the past hundreds of years in our kitchen cabinets, not necessarily in our medicine cabinets, that are good for children's health. And so we're finding ways now that we can integrate spices and common ingredients that you might cook with for health of children, and we're understanding now why they work and that they are safe and in many cases very effective.
I love that there's one part of your book where you have some specific treatments, 10 spice rack resources that we should turn to. We have the list actually to share with our viewers at home. But one of them is cayenne pepper. That one really caught my attention. What is so good about that?
Well, it's counterintuitive because we always think of cayenne pepper as being something very spicy, and when we cook with it, that's the way we use it. But there's a substance in cayenne pepper called capsaicin, and you'll actually see this in over-the-counter ingredients now for pain relief. And it turns out that the capsaicin in the cayenne pepper can numb different nerve impulses. It's anti-inflammatory. As you can see, it also helps with pain syndromes like headaches, but it's used mostly topically. We use it for insect bites and other peripheral painful conditions.
And just to mention a few of the others, clove, dill, mint, cinnamon, all of that is good stuff?
Oh yeah, it's remarkable. When you go out in your garden and you're growing basil, you're growing mint, all of these things, even in my own garden, we have oregano or mint things we grow, and they taste good as teas, but we're finding, mint, for example, is very good for digestive disorders. Dill was one of the first things used in the first colic remedy in gripe water for kids hundreds of years ago. So these are all really useful things for a family's health.
You also have a part in the book with the top 10 super ingredients, as we like to call them. Apple cider. Apple cider is really big on the list. I actually take this every day, a tablespoon of it. Tell us why it's so good.
Well, apple cider vinegar is used both internally and topically. In children, we tend to use it more in topical conditions, things that are skin conditions like acne or warts, but it's also people that drink it find that it can help with your metabolism, in some cases lowering cholesterol or helping with blood sugar. There are many different things digestively that it can help with, mild heartburn, digestive disorders like indigestion or irritable bowel syndrome. So it has a lot of uses.
Sea salt is on there too, and in this day and age, a lot of people say, oh, salt? Wait, aren't we supposed to be cutting back on salt? What's good about that?
Well, so it just shows you that you have to be mindful that just because things are natural doesn't mean necessarily they're safe. But sea salt is used in for many respiratory conditions. There are studies actually going on now looking at nebulizing or putting in a humidifier sea salt with some water for conditions like asthma or cystic fibrosis at higher concentrations, and the studies are finding that these things may be helpful. We use them in saline rinses for nasal congestion, allergies, and so a little bit used in the right way can be very helpful.
So when you talk about these alternative methods, is this to round out care from doctors, do you think, or can this really be a full replacement in your opinion?
Well, no, I think that they do round out. We talk about in the book what's called integrative medicine, and I think it's a paradigm that doesn't throw away all the good conventional things that we've done. We have a medical system that's done a pretty good job at taking care of acute care conditions, but when it comes to more chronic conditions, or even in some first aid cases, we're integrating many of these therapies with conventional therapies. So in my practice, when I see a child with an earache, we're saying to parents, look, if you're interested, there are other ways. You talked about olive oil or garlic, and we can make a mixture of those to use for earaches or ear infections, but we're not saying that there's never a case for treatment like antibiotics. So it's really an integration, and I find that more and more families are interested in this type of integrative care.